Residential Addiction Treatment Billing Codes H0017, H0018, and H0019. Pick the wrong one, and every day of service gets denied. 3 codes cover residential addiction treatment. Use the wrong one, or include room and board, and the claim comes back denied. What each code means, when to use it, and the distinctions that prevent denials. We will walk through each code so your billing team can submit residential claims correctly. Before the codes, a precise definition, because the setting determines which code applies. Residential programs are live-in behavioral health programs where patients temporarily reside at the facility. These programs resemble homes more than hospitals, and are not typically staffed by medical personnel around the clock. Residential serves medically stable patients who need behavioral health care, not close medical supervision. Wrong code, wrong setting, or bundled room and board. Any one of these puts every claim at direct risk of denial. H0017, H0018, and H0019 cover clinical services only. Bundling room and board into the claim is a billing error. These codes apply only to residential programs. Hospital-based settings require a different code family. H0018 and H0019 differ by program length. Using the wrong one creates a mismatch with the authorization on file. Generic EHR platforms have no residential H-code logic built in. Billers catch errors manually after submission. A behavioral health-specific platform is designed to surface residential code mismatches before a claim goes out. Daily notes tie directly to the H-code claim. The documentation that supports continued stay review is already there. Here are the 3 residential billing codes and when to use each one. All 3 cover clinical services only. Let us walk through each one. H0017, Behavioral Health, Residential without room and board. H0017 describes 1 day of clinical services at a residential behavioral health or addiction treatment center. Billed per diem, 1 claim for each day of residential service. H0017 covers clinical services only. It is a HCPCS Level 2 code accepted by Medicaid and many private payers. H0018, Behavioral Health, Short-term residential without room and board. H018 is for short-term residential programs, any program running less than 30 days. The standard 28-day residential program falls under H0018. This code applies only to residential treatment, not hospital-based programs and not outpatient settings. H0019, Behavioral Health, Long-term residential without room and board. H0019 is for long-term residential programs, any program running longer than 30 days. Many H0019 programs run 60, 90, or even 120 days, depending on the severity of SUD symptoms and co-occurring disorders. H0019 applies only to residential settings. Hospital-based programs and acute care facilities require a different code family. The only difference between H0018 and H0019 is program length. That one variable drives the authorization. Short-term is under 30 days. Long-term is over 30 days. Both exclude room and board. Both require a residential setting. Here are the most common mistakes with these codes, and how to avoid each one. Room and board is not covered by H0017, H0018, or H0019. Bundling it into a claim results in a denial. If the program is hospital-based, residential H codes do not apply. These codes are for non-hospital, community-based residential settings. A 28-day program billed under H0019 or a 90-day program billed under H0018 creates an authorization mismatch. These codes are per diem. Submit 1 claim per day of service, not per admission or per week. The right code is only half the equation. Documentation must support the level and duration of care billed. Notes should link interventions to the client's active ICD-10 diagnosis and show measurable progress against the treatment plan. For 60, 90, and 120-day H0019 authorizations, strong daily notes are what defend continued stay review. The record must clearly reflect that the patient is in a residential, not hospital-based or acute care, setting. Stop losing residential claims to code mismatches. See a demo of the billing tools designed to connect clinical documentation to clean H-code claims. Book a 20-minute demo at behavehealth.com and see residential billing built into your workflow.